Hey guys, happy quarantine Sunday. Today is Sunday, April the 19th, 2020. And my name is Meredith Hurston. I am a board certified clinical laboratory scientist, which means that I work for an academic medical center in a hospital where we test blood. And one of the tests that we're doing is COVID-19 testing for RNA, and we're doing a couple of other tests as well. And I would like to talk to you today to share some little known information that you may find very valuable if you or a family member or friend gets into a situation where they're having some severe COVID-19 symptoms and are going to have to go to the hospital to be hospitalized, to be admitted. So the first thing that I want to talk to you guys about is what is being called a cytokine storm. So a cytokine storm is basically when your immune system ramps up and gets into overdrive and doesn't know how to turn itself off or slow back down and shut off. And that happens in response to a virus or a bacteria entering your body. It's natural for your immune system to flare up, like you might have lymph node, swelling and things like that. I'm sure we've all had that in the past, like when we had some sort of bacteria or viral infection. And then normally it'll go back down. Those lymph nodes will, go back down to normal size, the pain will stop and all of that. But in a cytokine storm situation, the immune system just keeps going, it keeps skyrocketing. So that can become dangerous and it can lead to organ failure. And that's what we're seeing in severe cases of COVID-19, typically that lead up to a person dying and passing away. So specifically, there's something called interleukin 6 or IL-6 that the laboratory can test for to determine if a patient is having a cytokine storm related to their COVID-19 diagnosis. So this is what I want to share with you. If you or a family member, most likely it'll have to be your family member or somebody is going to be an advocate for you. So what that means is there's like a point person in your family or your point person that's your friend that's going to keep in touch with the doctor on a daily basis or your medical care team while you're in the hospital. So that advocate should be asking the doctor, what's your condition? Are you improving? Are you declining? Things like that. How are you being treated? Just, check in on a daily basis. So one of the things you can ask the doctor is, have they ruled out a cytokine storm, particularly if the patient is declining, they aren't getting any better. Ask them, use this phrase, have you ruled out a cytokine storm? And if they ask you, what do you mean? Say, have you tested them for IL-6? And so once they test you for IL-6, if those levels come back elevated, that is indicative of a cytokine storm. And there are some medications that can be used to treat that and to decrease the IL-6 level. And I found out about this week when I was at work, and it excited me a lot because what they're saying is when they draw these IL-6 levels and then they administer a drug, which is known as an anti-IL-6, the numbers are coming down after 12 hours. So that can lead to an improvement in the patient's condition and hopefully save their life. They're seeing people recover from these severe, COVID-19 spells, where they're on the ventilator and their lungs are locked up and all of that stuff. So that's what you can ask the doctor for. Have you done an IL-6 test? And if they say no, ask them, is it possible that they could do it? And, are they going to monitor the patient to see, how their immune system is functioning? So with that, it's important to note with those anti-IL-6 drugs, this is a treatment and it's a clinical trial treatment. It's not like an FDA approved treatment because we don't have FDA approval for anything related to COVID-19. So this is not a cure. It's a clinical trial treatment, something that's worth trying, particularly if the patient is on a ventilator and declining. One of the things that I wanted to bring to your attention is Dr. Kizzmekia Corbett. She's a Black woman that works at the NIH, and she's leading up at the helm of the project for developing a COVID-19 vaccine. They are trying to discredit this lady and come at her sideways, talking about she's racist and a bigot. Y'all check her out on Fox News. It's a mess. So please lift her up and send her good vibes because they're trying to destroy her. And we need her because she's working on the vaccine, which could potentially be a cure for this. But getting back to the IL-6 testing, please know that the test is expensive, as well as the clinical trial drugs that are available. Those are expensive as well. So the doctor or the hospital may not want to provide them for you, but know that this is out here. This is my point of making this video. I want you all to be aware that these things exist and trying to put it in some common terminology so that everyone can understand. And to that point, if you don't have insurance, or if you've been recently laid off, or your job has been furloughed or what have you, you may be eligible to get insurance through the healthcare marketplace, which is healthcare.gov. So check that out to see if you're eligible. Even if it's a high deductible plan, get some type of insurance if you don't have any. And if you're eligible for Medicaid, check with your state to see if you're eligible for that. But you want to have some type of coverage, even if you aren't sick in this moment. We don't know how long this thing is going to last. So it's important to have some type of health insurance coverage, even if it is Medicaid, if that's what you're eligible for. Something is better than nothing at all. So, that's really all I had. I wanted you guys to understand the significance of the cytokine storm and interleukin 6. But before I go, we're starting to see some reports, especially out of New York. Governor Cuomo was just on the news saying that they are starting to see a decline in hospitalizations, which is a good sign. And I also know that the president is trying to open back up states and get the economy going again. I'm not going to get into the politics of that, but the point that I want to impress upon you is to continue doing social distancing. If your state opens up, your job opens up, or what have you, if you want to get out and about and return to normal life, please don't do that with any sense of urgency. Please continue to practice social distancing, wear your mask. I live in Maryland. That's one of the states where masking in public is not required as of yesterday, I believe. So please continue to wear your mask. And practice social distancing. If you're not with the people that you live with, you want to stay 6 feet away from anybody that you don't live with. And, cover your mouth. If you're sick, absolutely stay home unless you're going to the doctor or the hospital. And if you're going to the doctor, that should be a telemedicine visit over video or phone anyway. So the real reason you should only be out if you're sick is to go to the hospital. So I am glad that we're seeing progress. And the numbers are starting to come down in some areas, not all. Some areas are still seeing like a plateau. Some areas are still on the incline in terms of cases, but you all stay safe. I know this is a major adjustment for everyone, myself included, but I hope this info was helpful to you. And if you found it helpful, please save this video, save it. If you're on Facebook, click save so you can refer to it for future references. Save the link, send it to your Evernote, send it to something. Just make note of it and please share if you find this relevant. It could help someone improve their outcome or save their life. Have a good day.